Welcome to your trusted source for insightful conversations about brain health and overall well-being. I'm Kelly, your host, and today we have Dr. Modi, a neurologist passionate about demystifying the complexities of the human brain. Today, we're diving deep into a topic that affects millions of Americans each year, concussions. Again, joining me today is distinguished expert in the field of neurology with extensive experience in stroke and concussion management. This is Dr. Simul Modi. Welcome to the show.
Yeah, thank you, Kelly. Thanks for having me.
Today, we're aiming to shed light on the far-reaching consequences of concussions beyond the immediate symptoms. Concussions are often dismissed as minor injuries, but the reality is far more complex. In the United States alone, an estimated 1.6 to 3.8 million sports and recreation-related concussions occur each year. But this number doesn't even account for the concussions caused by falls, car accidents, or other incidents. The impact of these injuries ripples through families and communities, disrupting lives and straining the healthcare system. The financial burden of concussions is substantial, with direct medical costs exceeding $17 billion annually. Lost productivity, missed school or work days, and long-term disability further compound the economic toll. But perhaps most importantly, the human cost of concussions is immeasurable. Dr. Modi, could you elaborate on the common misconceptions surrounding concussions and the potential long-term consequences?
Yeah, absolutely, Kelly. So, one of the most pervasive misconceptions is that concussions are only a concern for athletes. It's not true. Well, sports certainly contribute to a significant number of concussions in the country. Anyone can experience a concussion from a bump or a blow to the head or a jolt to the head. Another misconception is that losing consciousness is a prerequisite for a concussion diagnosis. In reality, most concussions don't involve loss of consciousness. You don't even have to have a direct impact to the head. Something like a whiplash movement of the head can cause concussion.
It looks like people suffering from a concussion don't often know about this, that you don't have to have a direct impact to the head or loss of consciousness to have a concussion. So really then, how should we look for the symptoms of a concussion? Can you briefly talk about some of the common symptoms of this?
Yeah, sure. So, concussions are also known as mild traumatic brain injuries and can cause a range of symptoms. Some of them are immediate and some of them are delayed after a few days. So there are physical symptoms, cognitive symptoms, and emotional symptoms, like three main categories. Talking about physical symptoms first, headaches. Headache has a couple of mechanisms in concussion. First, there is an injury to the muscles in the neck that can cause spasm of the muscle around the head. And sometimes concussion can trigger the migraine networks in the brain, so the headaches are more migraine-like. Concussion can also cause nausea and vomiting. Often, nausea and vomiting starts immediately after the concussion. It can cause fatigue and drowsiness, dizziness, balance problems, spinning sensations. Some patients are lightheaded, and some patients have perception of motion and loss of balance. Sensitivity to light and noise is also common. Other category of symptoms is cognitive symptoms, and these are the ones that's hard to detect. Confusion, feeling foggy or brain fog, loss of memory, especially short-term memory, difficulty remembering things, and feeling slow and inefficient. And now the third category of symptoms is emotional symptoms. These are even harder to detect because patients may not be aware of them. Being irritable, mood swings, anxiety or depression, sleep problems. Often patient doesn't notice these symptoms. It's the family and friends that notice this. On top of these symptoms, they last for a few weeks and months. They even can last for years or lifelong.
Oh, wow.
The long-term consequences of concussions are also devastating. They can affect your quality of life, income, education, relationships. Repeated concussions can increase the risk of developing chronic traumatic encephalopathy, CTE. It's a degenerative brain disease associated with memory loss, mood swings, and cognitive decline.
These are sobering statistics and insights, Dr. Modi. It's clear that we need to approach concussions with greater urgency and implement comprehensive strategies for prevention and management that take all of this into account. Since it's difficult to diagnose, is there any testing that we can do for this?
Most concussions are diagnosed clinically. Since the damage in the brain occurs at microscopic level, we usually can't see it on the CT scan or an MRI or anything like that. There are some special MRI sequences like MRI, DTI, or also known as diffusion tensor imaging, that may detect some of these findings. We can also record eye movements to see if there is any abnormality, since eye movements are commonly affected in concussion. These eye movement abnormalities are so subtle and they need special cameras to detect them. That test is called VNG, or a video nystagmogram. There are also some blood tests like biomarkers that are released in the blood when the brain is injured. There are two main biomarkers, GFAP and UCHL1. They're detectable in the blood for 2 to 3 days after a concussion.
Okay, that makes sense. It seems like that would be something that emergency departments would need to do and do pretty quickly in order to make a difference here.
Absolutely.
Let's shift our focus to potential solutions. Dr. Modi, what are some key steps that we can take to address the concussion epidemic?
So prevention is paramount in sports, enforcing stricter rules, promoting proper tackling techniques, and improving helmet technology can significantly reduce the incidence of concussion. In motor vehicle accidents, wearing seat belts is extremely important, even sitting in the rear. And obviously, anything that reduces the chances of causing accident would help. And raising awareness about fall prevention in elderly can also help. When a concussion does occur, early diagnosis and appropriate management are essential. Resting is crucial in the initial stages of recovery, but gradual return to activity under the guidance of a healthcare professional is also important.
It sounds like the key is really a holistic approach to whole patient well-being, a multifaceted approach that takes into account everything that you've talked about here, and all the ways that this impacts the patient's lives. Education, prevention, and comprehensive care also all play vital roles. As we wrap up our conversation, Dr. Modi, are there any final thoughts that you'd like to share with our listeners?
Concussions are underdiagnosed. I would say if you have experienced sudden blow or jolt to the head, then look out for these symptoms. Earlier diagnosis and treatment can improve the outcome.
Thank you, Dr. Modi, for sharing your expertise and insights with us today. It's been an enlightening conversation. And to our listeners, thank you so much for tuning in. Remember, knowledge is power when it comes to brain health. Stay informed, stay safe, and prioritize your well-being. Until next time, take care of your most valuable asset, your brain.